We've heard a lot about breast cancer prevention and treatment, but there is a component that is not spoken about as often: the physical and emotional impact that comes with the loss of a woman's breasts from the treatment or prevention of cancer. Joining me now is Dr. Ron Israeli, a plastic surgeon who specializes in breast reconstruction. He's also a sculptor who developed a project called Breast Reconstruction, Restoring Wholeness. And he created life-cast breast sculptures of 6 of his patients as a way to offer hope to the newly diagnosed. And also joining him is breast cancer survivor and patient of his, Lucienne Colombo. Thanks to both of you so much for being here today. Lucienne, I'm going to start off by playing a soundbite of yours where you speak about the project.
It just was a bad but good dream. I had qualified to be a conductor at the Long Island Railroad. I bought a house.
Thank you.
I was ready to really push forward and have a life. Meet somebody who knew. Hi, how are you? Everything was going to be good. And then they said, you have breast cancer. Oh my God.
So Lucienne, that was the point in your life when you were first diagnosed with breast cancer. How long ago was that?
July 21st, 2008.
And how are you now? You look fantastic. How are you now?
Awesome.
You beat it. Yes.
I did beat it.
Great. Congratulations. Wonderful to hear. And how did you first get in touch with Dr. Israeli?
Through Molly Sugarman, who was there when I was diagnosed, and she referred me to use Dr. Israeli, and it was the best decision.
Was it a complicated time for you? A very emotional time?
It was very emotional. It was, you know, at that point, everything goes quickly. You're in a rush to do everything. You want results tomorrow, the next day. So, yeah, you just kind of follow the wave. You just ride the wave, and you wind up, you know, where you wind up is hopefully where you should be.
Exactly, exactly. And Dr. Israeli, tell us how you came up with this concept of sculpting your patients' breasts to give them a sense of hope.
Yeah, you know, it was, since I started my practice in plastic surgery, I started working with a sculptor and various sculpture projects. And there was one project in particular where we did a life cast of, not a patient, but a model. And it just occurred to me that this might be something that I can apply, you know, to my breast reconstruction patients. And it was almost a way that I could show in a tangible way, to give them a tangible understanding, a visible sort of heightened awareness through a three-dimensional sculpture of what the process of breast reconstruction really is.
Because it can be terrifying for women. At one point you say in your documentary that some of your patients would rather not be treated, not have a mastectomy, than lose their breasts and all that entails.
Right, and you know, fortunately that's not most women, and you know, the quality of what we can achieve now in breast reconstruction is so much better than it was in the past, and it's on the forefront of national health care agendas, and it's out in the media, so that women know that there's that option for reconstruction. But yeah, you know, the fear of mastectomy is a very real one, and again, you know, being able to see something through a project like this. You know, one of the women that I did the life cast of had a mastectomy. She hasn't had reconstruction. And during the exhibit, we were able to see her reaction. You know, her reaction not only to seeing herself having had a mastectomy, but her reaction seeing the other life cast sculptures, which were all of women who've had reconstruction.
And what was her reaction?
Well, I think it kind of affirmed in her mind, you know, that there's a light in the end of the tunnel. She's going to be okay.
Right.
And the decision to do reconstruction for her was, you know, is the right one.
So in the end, she did decide to.
She decided to do it. She hasn't done it yet.
Right.
But that's the kind of I guess, response or reaction that I would hope that a project like this could elicit, you know, to inspire and to hope, to provide hope.
Do most patients opt for reconstruction?
Well, the truth is, in the United States, reconstruction is not offered to actually most women that undergo mastectomy. And while that may not be true in
you mean it's not covered by insurance?
It's not that it's not covered by insurance, because there's a Women's Health Care Right Act of 1998 that does, to some extent, mandate insurance coverage for breast reconstruction for women with breast cancer. But I think that there's availability in some parts of the country that's lacking. There's sort of awareness that's lacking, and you know, so in fact, while across the country most women may not be even offered it, certainly in our community, it's something that that really most women opt to do.
And Lucienne, you opted for reconstruction, correct?
Definitely.
Are you happy you did so?
It was a no-brainer.
Yeah, right away you knew that's what you were going to do.
It was 4 weeks and 2 days from diagnosis to a double mastectomy, and then I had my reconstruction a year later. But
and how wonderful to see you sitting here so happy and healthy and beautiful. Lucienne Colombo, thank you so much. Dr. Ron Israeli, thank you so much for being here.
Thank you, I appreciate it.
Thank you.